Hey guys, nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Today we're gonna talk about the chest X-ray and CAT scan findings of lymphocytic carcinomatosis. Let's go. The definition of lymphocytic carcinomatosis according to Wikipedia English version is like this. Lymphocytic carcinomatosis is the inflammation of the lymph vessels, so-called lymphangitis, caused by malignancy. Breast, lung, stomach, pancreas, and prostate cancers are the most common tumors that result in lymphangitis. Lymphocytic carcinomatosis was first described by pathologist Gabriel Andra in 1829 in a patient with uterus cancer. Lymphocytic carcinomatosis may show the presence of curly B lines on chest X-ray. I'll quote a couple of definitions from others, such as lymphocytic carcinomatosis is a term given to cancer spread through the lymphatics of the lung. Lymphocytic carcinomatosis is the infiltration and inflammation of lymphatic vessels secondary to the spread of malignancy from a primary site, a serious condition in which cancer cells spread from the original tumor to the lymph vessels. Now you can get the definition of lymphocytic carcinomatosis clearly into your mind. Etiologies are like this. 6 to 8% of all pulmonary metastases are lymphocytic carcinomatosis, and 80% of lymphocytic carcinomatosis are from adenocarcinoma. The most common primary sites are lung cancer and breast cancer, and sometimes from stomach, colon, prostate, pancreas, cervix, thyroid, and larynx. Radiographic findings of lymphocytic carcinomatosis. Radiographic appearances can most easily be divided into those involving the peripheral and the central lymphatic system. Involvement may be both or dominantly of peripheral or central. Distribution is variable but usually asymmetric, but it is usually unilateral in cases of lung, breast cancer, but may be bilateral. Chest X-ray findings. A quarter of patients show normal chest X-rays. When abnormal, the most common finding is a reticulonodular pattern with a thickening of the interlobular septa, which may resemble curly B lines. This is the most important slide of this session. CAT scan thin section CT findings of lymphocytic carcinomatosis as irregular nodular thickening of the septa, fissure, and the pleura, peribronchial vascular thickening, and polygonal arcades formation, and of course mediastinal and hilar lymphadenopathy, also with pleural effusion, more on the unilateral side than bilateral. Underlying malignancies are usually from lung cancer and breast cancer. Let's have a short break time enjoying the Korean traditional folk painting, one of the famous in Korea. The name is A Scene in May, Springtime. 19th century, early 19th centuries, and 35 centimeter, painted by the painter named Shin Yun-bok at Kansong Art Museum, Seoul, Korea, from the Wikipedia. Very colorful. In the small belly stream, pleasant mood. Beautiful ladies with heavy black wigs on their head. natural beauty. Very colorful with red, yellow, blue, black and white. How about the two people, the young priest in the left upper side behind the rock, two men watching different ladies, peaceful, colorful, pleasant. Let's compare with the paintings of Auguste Renoir, large bathers on your left upper side. Sir, you quit smoking? Oh, wonderful. The most wonderful job of you this year. Congratulations. Let's start the museum tour of lymphangiotic carcinomatosis. Very characteristic and tragic findings of the chest radiograph. First case is from lung adenocarcinoma on right side. Both lungs are abnormal, most severe on the right side. On the chest radiograph, we see not only curly B line, but with reticular nodular pattern. There are small nodules in between the curly lines. That is reticular nodular pattern. You can see the reticular nodular pattern on the thin section CT on your right side in the yellow circle. We see septal wall thickening, prominent core structure in the lobule, arcade formation on left side, of course, also with pleural effusion on both sides. This is the lower portion, inferior pulmonary vein level of the previous patient. We see the peribronchovascular thickening on right lower lobe in a yellow circle. We have both side pleural effusion. This is another patient with a right lung cancer and colon cancer. Let's start from the right side chest X-ray. His right lung shows diffuse haziness with right lower lobe mass, with curly B line with reticular nodular density prominent everywhere on the right lung. Also, left lung is very less severe than right, but also showing us reticular nodular pattern of involvement of lymphangiotic carcinomatosis. Let's move to the left side chest X-ray. This is earlier stage with less prominent curly B lines, reticular nodular pattern. It is easier to understand the reticular nodular pattern on left side because we are already familiar with late stage of right chest X-ray. CAT scan findings of the same patient, same stage. On your left side, this is early stage. We see prominent core structure in the centrilobular nodule and septal thickening on the yellow circle. It became more prominent, more irregular, more nodular on the right side, the later stage, also with a prominent septal thickening, pleural thickening, bronchovascular thickening, mass on the right lung. Lower level CAT scan findings of the same patient. On earlier stages, the central core septal thickenings in yellow circle is less prominent, smoother than the right side, later stages. On your right side, later stage, the central core is prominent, septal thickening is more irregular, not smooth, and fissural thickening, peribronchovascular thickening. We all see the later stage findings on right side CAT scan. We also see the upper part trachea, 2R lymph node enlargement, and large amount of right pleural effusion. They are common findings with lymphangitic carcinomatosis. This patient is showing us right upper lobe squamous cell carcinoma with hemo-lymphogenous metastasis. Hematogenous metastasis plus lymphogenous lymphangitic carcinomatosis. We see the right upper lobe consolidation or mass and right pleural effusion with the right lung reticular nodular densities in right lower lobe CP angle area and also with around the right upper lobe mass. And also see the left upper lobe metastatic nodule and reticular nodular pattern on the left lower lobe, although less severe than the right lung. On his thin section CT of right upper lobe squamous cell lung cancer, we see in front of the mass, we see the core structure, septal thickening, arcade formation, and behind the mass, we see the peribronchovascular bundle thickening, fissural thickening, and on his left upper lobe, we see the variable size of hematogenous lung metastasis. So this is the combination of hematogenous lung metastasis and lymphangitic carcinomatosis. Maybe now you completely understand the findings of chest X-ray and CAT scan of lymphangitic carcinomatosis. So let's enjoy the last picture of the hemo-lymphangitic metastasis of this patient from lung cancer. Lung cancer is from right side. On his right lung on chest radiograph, you see the reticular nodular pattern, and his left upper lobe, we see nodules and reticular nodular pattern, and on thin section CT of right lower lobe shows all findings: septal thickening, arcade formation, prominent central core, bronchovascular bundle thickening, and on posterior portion, hematogenous metastatic nodules, right? Now we mastered the findings of lymphangitic carcinomatosis from lung cancer and breast cancer. Congratulations! But as you know, regrettably, these findings are all showing us he is or she is late in a later stage to be recovered. So it's very sorry findings. So quit smoking is more important than the understanding of the findings of lymphangitic carcinomatosis. You liked? Thank you very much. Grazie. Be happy. See you later.